Everyone, myself Dr. Taposh, and welcome to our channel Physiomax Organization. We are continuing our medical education series and understanding about the supraspinatus tendinitis. We have already discussed about the pathomechanical changes. We have already discussed about the biomechanical aspects of supraspinatus tendinitis and also the clinical features and the patient's oriented problems regarding supraspinatus tendinitis. Today we'll discuss one of the most commonest special tests what we perform while assessing a patient of a supraspinatus tendinitis, and that is about the empty can test. Before understanding the empty can test, again we will read this empty can test under this format. So students, those who are watching this video, again the physio, those who will be doing these procedures for their patient, you need to remember while doing this supraspinatus tendinitis special test as a part of empty can test, you need to follow these all the 5 points. So those students, they need to write their answer in this particular point like that indication. So indication of this empty can test is the supraspinatus tendinitis. The second one is the patient position, therapist hold, procedure and rationalization. We will understand one by one each step now. Then we will know about the sensitivity and specificity of the special test and the biomechanical aspect. That's the most important of understanding this any type of special test, which mostly people used to neglect, and most of the things it's not discussed during understanding the special test or regarding any type of orthopedic pathological conditions. We will also know about that. So the first we understand this empty can test. What will be the patient position? Either the patient can be in a standing position or a sitting position. It's better to make the patient to be in a sitting position. So consider this is the patient and the patient is in a sitting position, relaxed sitting position, and the affected arm on the side, that's the patient position. The first one is the patient position. So this is the patient position. The second one is the therapist position. The therapist position, therapist need to stand in front of the patient. Therapist is standing in front of the patient. Now the therapist hold. Therapist will ask the patient now to leave the arm in a horizontal abduction position. Now what is this horizontal abduction position? That's what you need to understand. Here patient will actively lift the head. This is what is called as a abduction. This is what called as a flexion. Horizontal abduction is the position which is also called as a scapular motion plane. There's the scapular plane motion here. This is what is the horizontal abduction, which mostly used to happen under the part of scapular plane. So the patient is to lift the hand in this scapular plane. This is the therapist hold. So when the therapist will ask the patient to lift in the hand in a horizontally abducted position, what the patient will do? The patient will make a thumb in this position and will lift the hand like this. Now the therapist will ask the patient to empty the can. It's like you are holding a can and you are just pouring the water. So you are doing like this. It can be done also while the therapist can give a mild resistance while doing this rotation, while doing this internal rotation. So the therapist hold, therapist will be standing in front of the patient. The first patient will do the horizontal abduction at a 90 degree because here the supraspinatus tendon are in a most taut position, and patient will try to do this thumb downward position like empty the can. Here the therapist also that's a sensitization phenomena. Therapist also can resist this movement. The therapist will resist this internal rotation. Now there's a procedure, and now what's the rationalization? The rationalization will be while doing this, the internal rotation like empty the can at 90 degrees of abduction position, pain will be felt just below the subacromial process. Then if the pain will be felt below the subacromial process, we can tell the test is positive. So this is was the basic procedures of understanding the supraspinatus tendinitis most important special test, that is the empty can test. So under this 5 point we have to read like the indication, patient position, therapist hold, procedure and the rationalizer, keeping indication as a total 6 points we are having to read this. So first is the active, followed by that's the passive resistance can be applied. Now we need to understand this test is the how much it is sensitive and how much it is specificity. That means the sensitivity value and the specificity value of this particular test. It is called, or research has proved, the sensitivity value which falls within a 68 to 79 and the specificity value it is 67. Although this test is having a higher sensitivity, the specificity value of this test is bit low. What does it indicate? It indicates only empty can test cannot directly diagnose the supraspinatus tendinitis or tendinopathy or tear or any type of subacromial pathology. For that, for a confirmatory test, we either need to go with some other confirmatory test or we need to rely on MRI. That's the specificity value, although the specificity value of this empty can test is bit low compared to the other special test. So we can confirm this test with other test to come to a particular conclusion. Now, what's the biomechanical aspects? What exactly happening when we are doing this empty can test? That we need to understand now. That is, normally, whenever I am doing the abduction in this, at 90 degree, there is a subacromial space. There is a maximal amount of subacromial space where the supraspinatus tendon can move easily. But if I move my hand in a horizontally abducted position in a scapular plane motion like this, there is a very minimal amount of subacromial space which follow. And as during this horizontal abduction, there is a very minimal amount of subacromial space, there is a huge chance if there is a tendinopathy, tendinitis, there is a huge chance there is a impingement or a compression between the head of the acromion and the bony prominence of the head of the humerus, and that provokes the pain, and that denotes the test is positive. And that is the reason whoever will perform this empty can test, that needed to be either in particular exact in a position of horizontal abduction position. If you do a mistake keeping this hand in a flexion position, or if you do a mistake keeping the hand in a abduction position, then the test will be give a false negative report. So that's what about the empty can test. I hope you people understood. Again, we'll meet with some another special test regarding the supraspinatus tendinitis. Till then, thanks once again everyone watching this video. Those who are new for this channel, don't forget to subscribe this channel, and those who are watching all the series of our videos, don't forget to like this video, because for you people, for the educational purpose, we are making this type of all the pathological condition and related subtopics related to the orthopedic areas. So those who really want to learn, be with us. Another important thing I just forgot to tell you people, we are about to start a online teaching portion of different type of special tests. So these videos is mostly for the physios, those who wish to practice in a clinical process. So within a few months we'll announce of that, and stay tuned with us, because this going to be the ultimatum channel to learn different type of orthopedic, different type of neurological, different assessment procedures, and A to Z is the part of physiotherapy and other. For of course other medical professionals also can refer, but this is mostly for the physiotherapy students and the physiotherapy professionals. So stay tuned with us, because the channel will give you the A to Z knowledge of physiotherapy. That's what is my promise. Thank you.